Gun safety belongs in the doctor's office and in our hospitals. I'm Dr. Katherine Hoops, and I'm the Director of Clinical Programs and Practice in the Center for Gun Violence Solutions. Healthcare professionals like doctors, nurses, and nurse practitioners are considered some of the most trustworthy professions in America. Sometimes people look to those trusted sources to make changes in their lives. We can help our patients make decisions about their safety and health, and we have a responsibility to support their safety and well-being. That responsibility extends well beyond our offices and our hospitals. Firearm violence is a public health emergency, and we need to treat it like that. But many clinicians report feeling uncomfortable talking to their patients about firearm safety. My team has developed a simple educational tool to guide clinicians through the process. It's called the 5 A's. So first, ask. This is a patient-centered framework that centers on inquiry and wanting to learn more about your patient. So, do you happen to have guns in your home? What's been your experience with firearm safety training? How do you currently store your guns and your ammunition? Next, advise. Explain secure firearm storage, that all firearms should be stored unloaded, locked up, and separate from ammunition when they're not in use, and describe why that's important for preventing injury in the home. If you're particularly concerned that your patient might be going through a hard time or might be at risk of suicide, you may need to advise them on heightened protections in the home, like giving the key to their safe to a trusted friend. Or they may decide that they want to store their guns out of their home, such as with a close relative. Next, assess their interest in practicing safe storage and see how you can help them do that. Then assist. If they're interested, then provide resources like cable locks or gun safes if you're able, or help them figure out where they can get one. Finally, arrange. Arrange follow-up with your patient in a week or two and see how it's going. Have they been able to use that safe storage device? And if not, see how you can support them. You can learn more about the 5 A's on our website. And remember, safe storage saves lives, and so can a conversation like this.